Identify blade size. The answer is C. 15. Onset of puberty before the age of 8 years in girl is called precoce puberty. Glutaraldehyde is used widely as a cold sterilant to disinfect a variety of heat-sensitive instruments. Give the example. The answer is C. Laparoscopic instruments. What room temperature should be maintained during the period of phototherapy? The answer is C. 28 to 30 degrees Celsius. Choose the correct statement regarding ECG changes in hyperkalemia. The answer is B. To perform catheterization, the nurse should place a woman in. The answer is B. Dorsal recumbent position. Stunting refers to. The answer is D. Low height than what is appropriate for a certain age. What are the characteristics findings with regard to CSF after a lumbar puncture is performed on a child who has bacterial meningitis? The answer is A. What is trimester-wise weight gain in pregnancy? The answer is C. 1, 5 and 5 kg. The common normal site of implantation of blastocyst in the uterus is. Answer is A. Upper uterine portion. Height measurement of 2 years old child is done by. The answer is A. Stadiometer. A nurse is preparing the client's morning NPH insulin dose and notice a clumpy precipitate inside the insulin vial. The nurse should. The answer is C. Draw the dose from a new vial. DMPA is an injectable contraceptive given every. The answer is B. 3 months. Nurse on PICU advised to give 400 ml fluid to give on 8 hours. Draw factor is 60 drops per minute. Nurse will run the fluid at what flow rate? The answer is B. 50 drops per minute. The cardinal signs of a cardiac arrest include all of the following except. The answer is B. Dilated non-reactive pupils. Which of the following is a mydriatic? The answer is A. Atropine. The normal newborn hemoglobin level is. The answer is A. 17 to 20 gram per deciliter. Most sensitive index of the health of a community is. The answer is A. Infant mortality rate. Find the correct statement. Premature rupture of membrane is contraindication of induction of labor. 2. Gestational diabetes is the indication of induction of labor. 3. Cephalophilic disproportion is indication of labor. The answer is C. 2. Fluid of choice in burn patient. The answer is D. Ringer lactate is the fluid of choice in burn patient. Give the correct order of 5 stages of dying person. Answer is D. Denial, anger, bargaining, depression, acceptance. Which condition is defined as the inflammation of the peritoneum? The answer is C. Peritonitis. When caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? The answer is D. Check the vital signs every 2 to 4 hours. After birth of a baby, breastfeeding should be started. The answer is B. Within half an hour. The ratio of lung inflation of chest compression in cardiopulmonary resuscitation is. Answer is C. 1:3. Which of the following condition has an increased risk for developing hyperkalemia? The answer is D. End stage renal disease. During resuscitation in an infant, ratio of chest compression and ventilation breath should be. The answer is C. 3:1. A client with C4 spinal cord injury is at greatest risk for. The answer is B. Respiratory compromise. The microorganism that is usually a part of the normal vaginal flora but can cause meningitis in newborn is. Answer is C. Group B streptococci. A pregnant woman diagnosis severe anemia HB less than 7 gram per deciliter will be treated by. Answer is C. Packed cell transfusion. All are the clinical features of meningitis except. The answer is D. Constipation. What should be the immediate action in case of severe bleeding? The answer is A. Apply pressure to the wound. Adrenaline dose in anaphylactic shock is. The answer is A. 1:1000, 0.5 ml. How many movements of hand hygiene have been laid down by WHO? The answer is D. 5 movements. Long standing high blood pressure may result in. The answer is C. Heart attack. What is the drug of choice specifically for the management of convulsion in eclampsia? The answer is C. Magnesium sulfate. A client with psychotic depression is receiving haloperidol. Which of the following side effect is associated with haloperidol? The answer is A. Akathisia. Which of the following immediate management to restore blood pressure and peripheral circulation in a client with multiple fracture and fluid loss would be? The answer is A. Oral infusion. Which of the following hormone is also known as emergency hormone? The answer is D. Adrenaline. A lung disease caused by prolonged inhalation of cotton fiber dust is. The answer is B. Bichinosis. The causative agent of Lyme disease is. The answer is C. Borrelia burgdorferi. Which among the following is a sign of severe dehydration among infants? The answer is B. Drowsiness, depressed fontanelle, and decreased skin turgor. Which option describes orthopnea? The answer is A. Ability to breathe only in upright sitting or standing position. The obstetrical assessment of the reveals. This is a third pregnancy. Her first child was delivered at 38 weeks. A second child was delivered at 34 weeks. Calculate the GTPAL score. The answer is B. Patient arrived at emergency department after road traffic accident. Pulse rate 127 beats per minute. Blood pressure is 90/56 with cold extremities. The nurse understands the patient is at risk of which type of shock? The answer is B. Hypovolemic shock. When examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find. The answer is B. Flaccidity of the upper extremities. Contraindication of liver biopsy is. The answer is C. Increased activated partial thromboplastin clotting time. Normal blood pressure of the adult. The answer is B. 120/80 mmHg. The most preferred site of administration of intramuscular injection in children under 1 year is. The answer is B. Vastus lateralis. The below shown instrument is used in which surgery? The answer is A. Thyroidectomy. The mask shown in the image is known as. The answer is C. Non-rebreather mask. When serum bilirubin level rises on third and fourth day after birth of the baby due to inefficient hepatic function is known as. The answer is C. Physiological jaundice. Which of the following drug is prescribed to an antenatal mother for fetal lung maturation? The answer is C. Betamethasone. Which of the following medication is administered sublingually for managing angina pectoris? The answer is C. Nitroglycerin. The reference point for the measurement of JVP is the answer is B. Sternal angle. If a nurse evaluates the ECG and sees a sawtooth P wave, what will be the diagnosis then? The answer is A. Atrial flutter. Non-stress test is said to be normal if there are. The answer is A. 2 or more FHR acceleration during a 20 minutes period. Apical pulse can be assessed at. The answer is D. Between fifth and intercostal space in the left midclavicular line. What should be the ideal ratio of the cardiac compression and respiration during CPR in a child? The answer is C. 5:1. Which of the following is not included in the surgical safety checklist? The answer is D. Counseling. What is the name of the outer lip like structure that protects the entrance to the female reproductive system? The answer is B. Labia. Which solution should be used to mop up the spilled blood on the floor of the operation theatre? The answer is B. Sodium hypochlorite. Identify the post-renal cause of acute renal failure. The answer is A. Being prostatic hyperplasia. The reason for polyuria is best defined as. The answer is B. Diminished ability to the kidneys concentrate the urine. ECG given below is of. The answer is A. Atrial fibrillation. Most common symptoms of alcohol withdrawal is. The answer is tremor. Weber test is done to diagnose. The answer is B. Hearing loss. What is mandatory before glucose tolerance test? The answer is A. NBM 8 to 10 hours prior to test. Hand rubbing time for alcohol based hand washing is. The answer is B. 15 to 30 seconds. Identify the given image below. The answer is A. Tinea corporis. Gastric lavage is a procedure done to wash or irrigate the. The answer is A. Stomach. Which fluid causes shifting of fluid from cell to plasma? Hypertonic solution. What are the benefits of kangaroo mother care? The answer is D. All of the above. Vidal test is done in the diagnosis of. The answer is C. Enteric fever. Which of the following electrolyte imbalance is associated with digoxin toxicity? The answer is A. Hypokalemia. The infant has undergone for a ventriculoperitoneal shunt Surgical procedure on the assessment. How will you assess the sign of increased ICP? The answer is C. Anterior fontanel assessment. The Parkland formula for fluid calculation in burn patient. The answer is A. 4 ml into BSA into weight. The intermittent positive pressure breathing is contraindicated in. The answer is D. Tracheoesophageal fistula. Endogenous depression is also known as. The answer is A. Autonomous depression. What is the ideal position during a lumbar puncture? The answer is A.